Your body whispers before it screams, especially when something isn't right inside. And one of the quietest yet most common issues people ignore is a urinary tract infection. A UTI doesn't always show up loudly at first. Sometimes it starts with the smallest discomfort, the kind you brush off because life is busy and you don't want to overthink it. But your body always gives clues. And when it comes to UTIs, those clues matter, because ignoring them can lead to complications you truly don't want to experience. You might feel it during your next bathroom break. That sharp, burning sensation that makes you pause for a second. You shake it off, thinking maybe you didn't drink enough water today, or maybe it's just irritation. But that sudden burn is one of the earliest signs of a UTI. Your bladder lining becomes inflamed, and even a small flow of urine feels like fire. Many people wait until this symptom gets severe before paying attention, but your body is already sending red alerts. Another sign shows up when you feel the urge to pee way more often than normal. You go to the bathroom expecting relief, but barely a few drops come out. And the moment you step away, you feel like you have to go again. That constant urge, like your bladder can't make up its mind, is a huge indicator that bacteria have started irritating the lining of your urinary tract. Some people describe it as pressure, some as urgency, some as frustration. But almost everyone knows something feels off. Pay attention to what your urine looks like too. Healthy urine is usually clear to light yellow, but with a UTI, it often becomes cloudy, dark, or even smells unusually strong. Sometimes there's a reddish tint, which can be a sign of blood. That doesn't mean something catastrophic is happening, but it does mean the bacteria have already caused enough irritation to make tiny blood vessels bleed. And this is the moment you should absolutely not ignore your symptoms anymore. Lower abdominal discomfort is another clue. It's not exactly pain, not exactly cramping, but a dull, pressure-like sensation right above your pubic bone. Some people mistake it for digestive discomfort. Others think it's just bloating. But when you combine that feeling with frequent urination and burning, the pieces start fitting together. Your bladder is inflamed, irritated, exhausted from fighting off bacteria, and your body is trying to get your attention. And then there's the fatigue. Yes, UTIs can make you tired. When your immune system is busy fighting an infection, even a small one, your whole body feels it. You might feel sluggish, unmotivated, or just not yourself. Many people don't connect fatigue with UTIs, but it's a surprisingly common symptom, especially in older adults. And because UTIs can escalate faster in seniors, fatigue is often one of the biggest warning signs doctors look for. But here's where it gets serious. Ignoring a UTI doesn't make it go away. It gives the bacteria more time to climb upward, from your bladder toward your kidneys. And once the kidneys get infected, the situation becomes dangerous. Kidney infections can cause high fever, chills, nausea, vomiting, and severe back or side pain. At that stage, home remedies won't help. You need medical treatment immediately. That's why early detection matters so much. Some people also experience confusion or sudden changes in behavior, especially seniors. A simple UTI can trigger delirium in older adults because the infection affects the entire body. If an older loved one suddenly becomes disoriented, dizzy, or unusually tired, a UTI might be the hidden cause. It's one of the most misunderstood and overlooked symptoms in the aging population. And if you're wondering whether UTIs are common, the answer is yes, extremely. Nearly half of all women will experience at least one in their lifetime, and many will have recurring episodes. Men can get them too, especially after age 50, when an enlarged prostate can slow urine flow and allow bacteria to grow. Anyone can get a UTI, but recognizing the symptoms early is the key to preventing complications. Listen to your body. That burning sensation, that cloudy urine, that constant urge to go, none of it is random. These symptoms are messages from your body, warnings that something needs attention. Don't let embarrassment, inconvenience, or hesitation make you silent. Your health always comes first. And UTIs, when caught early, are treatable, manageable, and preventable. Stay hydrated, Practice good hygiene and never ignore pain or unusual changes. If symptoms worsen or you start experiencing fever, back pain or nausea, don't wait. Seek medical help immediately. Your kidneys, your immune system and your future self will thank you. UTIs may be common, but complications don't have to be. Early awareness is your best protection.